inbox is usually pretty fast, but I was hoping you can give us that reaction to the Supreme Court opinions. And on the substance of the matter there, how much of a blow is this to the administration's pandemic response plan to have the employer mandate part of the testing or vaccination mandate halted, and how will that affect the course of the pandemic?
Sure. Well, I know there'll be the statement from the president that should be coming into your inboxes any moment now. But let me give you a quick reaction. First, let me start with some good news. News that maybe isn't getting enough attention yet. That's our jobs here, or my job here, I should say. CMS's requirement for healthcare workers to be vaccinated will save the lives of patients, as well as the lives of doctors, nurses, and others who work in healthcare settings. It will cover 17 million healthcare workers at 76,000 medical facilities. The Supreme Court upheld it, and we will enforce that. The Supreme Court's decision on the OSHA mandate essentially means that in this pandemic, it is up to individual employers to determine whether their workplaces will be safe for employees and whether their businesses will be safe for consumers. So President Biden, you'll see this in his statement, will be calling on and will continue to call on businesses to immediately join those who have already stepped up, including 1/3 of Fortune 100 companies, to institute vaccination requirements to protect their workers, customers, and communities. We have to keep working together in order to get this done to save more lives. I would note that there are a couple of good signs in terms of without this, even in spite of the ruling, that we would point to. One is that 57%, according to a Navigator poll of Americans, support vaccine requirements. According to a Wills Tower Watson's report, a survey of 534 U.S. employers, a majority, 57% of respondents have or will require their employees to get vaccinated against COVID-19. Why? Because employees want to feel safe in the workplace, because they want to incentivize workers to come back to the workplace, and because they've seen large companies across the country implement this and see how effective it is.
Another adjacent COVID topic. The president announced today that he's going to announce next week that he's going to be the government's going to be making free, high-quality N95s available to Americans. There's the new testing website, which is launching next website. Why is it middle of January right now when a million Americans are testing positive for COVID a day roughly? Why is the president taking these steps now? Why didn't he take these 3 months ago?
Well, let me first say that what we've been working to implement is building on the steps we've taken over the last 6 months and more. Remember, when the president took office, there were 0 or 1 approved at-home testing option on the market. Now there are 9. We needed to expand the market capacity. The president used the Defense Production Act, $3 billion invested to expand that market. The reason he was able to announce the plan to purchase an additional $500 million beyond the $500 million we already announced is because of the expansion of the market. And just since last summer, leading up to December, we had quadrupled the size of the market. So if you look at the comparison, right now we're doing almost 12 million tests a day in this country. We were doing under 2 million tests a day a year ago. There's about 300 million tests that are happening in this country every single day, in part because there's 20,000 sites, because there are federal sites now across the country, new ones we announce every day, because we've sent 50 million tests to community health centers. So all of this is an effort to build on that and make sure that capacity and we're meeting the unprecedented demand for tests.
But these are steps that the president's taking now because there's an unmet need. Presumably, he could have done the exact same thing 3 months ago when maybe it would be in effect now when the need is obviously greater than the system has capacity to deliver on right now.
Well, I would say, Zeke, that again, because of the steps we've taken, we're able to, there's 300 million tests that are happening in this country every single month. And that is enormous progress. We're not starting from 0. That is my point. So this is building on that. But in terms of the number of tests available on the market and the expansion of the market, remember a number of them were just approved at the end of October or beginning of November. Using the Defense Production Act means we needed to ensure there's manufacturing capacity and build on that. This has all been a building process, and we're continuing to expand and build from here. I would also note that in recent polls, despite some of the conversations we have in here, it's less than 10% of the American public that can't find a test. We have expanded capacity, and you're seeing the impact of that across the country.
Lastly, on the voting push, we've heard a lot from the president talking about Republican-controlled states taking actions to limit ease of access to the polls. I'm wondering, election laws, we know, differ from state jurisdiction to jurisdiction. Has the president ever reached out to Democratic states, states like New York that don't have early in-person voting, or New Jersey or Delaware that have some different laws that exist, maybe down south, and called and encourage them to loosen their voting laws to bring them in line with some of the restrictions he's objecting to being rolled back right now?
Well, I think the president's view on expanding access to voting, whether it's the expansion of early voting or the number of mail-in voting boxes, steps we know works to increase the participation of people in the process, is something it's very well known that he strongly supports. The DNC typically does a lot of the outreach on election implementation, but I don't think it's a secret where the president stands, and certainly you heard him say that earlier this week and convey it again on Capitol Hill today.
Could you talk about